Hi, I'm Courtney Kovakovich. I'm completing this video for the head to toe assessment for Advanced Health Assessment Spring of 2019. Let's begin. Knock, knock.
Hello, come in.
Washing your hands, make sure your hand care for the patient. Hi, my name is Courtney.
Nice to meet you, Courtney.
I'll be the nurse practitioner taking care of you today. Can you tell me a little bit of what brings you in?
I need refills on my thyroid medicine and my high blood pressure medicine.
Okay. Are you having any headaches or dizziness with the blood pressure medication?
No.
Good. Well, any other new pains, new concerns other than the things you've already said?
No.
No? Okay. What else can you tell me about your past medical history?
Well, I have an underactive thyroid, I have high blood pressure, and I have lymphoma.
Okay.
So
You see a dermatologist for that?
I see the dermatologist for the lymphoma.
Okay, wonderful. You're able to keep those appointments regularly, see them on a regular basis?
Yes.
Wonderful. What else can you tell me about your family?
Well, there's breast cancer on my dad's side and high blood pressure, I believe, on both sides.
Okay. So is the blood pressure more the genetic causes or lifestyle? Like, is your job stressful? How are we doing there mentally? Tired more so than others?
It's probably a combination
Both.
of the two, yeah.
Are you able to have like good coping mechanisms? Like, how's your exercise regimen to maybe help with the stress?
Yeah, I'm underactive.
Okay, aren't we all?
Yeah.
Okay, and then tell me a little bit more of what you do.
I'm an auditor and I sit at the desk and work on the computer.
Okay. Are you able to get out, kind of enjoy your weekends a little bit with friends or anything?
Yes.
Yeah. Okay. Any use of drugs?
No.
Alcohol? How often do you say you would drink?
Lately I haven't been drinking at all, but usually it's once a week-ish
Okay.
or every other week.
Okay. Well, let's also give you just a physical exam, head to toe. You'll look over, see how we're doing there. We already were able to have a discussion with her. She knows why she's here. Do you know what year it is?
2019.
Wonderful. So I would definitely say she's oriented, answering the questions appropriately. We can move on to like maybe more cranial nerves now. Go ahead and look at me. I'm going to shine a light in your eyes. And this will look at your pupils and see how if they constrict and so forth. In the clinical setting, the patient would be in the gown. I would have asked her prior to starting the physical exam, after collecting the subjective information, all the health histories. I would step out for privacy. In the clinical exam, we would be using the otoscope, or for the eyes, the ophthalmoscope, to get a better look at her red reflex. With not having those currently, we would just be using a flashlight. For your eyes as well, in the clinical setting, we could use the Snellen eye chart. That would help assess her vision, how well she can see. So let me shine the light in your eye. I'm just going to look to make sure your eyes are like constricting appropriately and reactive. They look good. Look, I have the flashlight open. Let's continue on just looking at your ears, nose, and your throat. With the otoscope in the clinical setting, I'd have the black cap on. And then we always want to kind of pull the ear back a little bit and look for the tympanic membrane, making sure it has all the healthy characteristics, not red or inflamed, anything abnormal like that. Making sure she doesn't have too much earwax impacted, able to clean her ears. And yeah, look, I have to pull back your ear a little bit. Let me know if there's any pain, okay?
Yeah.
Okay, those look good. Your ears are symmetrical to your face. All the parts of your ears are good and healthy. Your skin is pink and moist. Let me look in your nose. Go ahead and look up. Perfect. Okay. In the clinical setting, I would have changed the caps from the ears to the nose. And then go ahead and say ah. Take out your tongue a little bit. Okay. Very good. There's no deviation with her tongue. And then her uvula rise and her mucous membranes are pink and moist, not red. Her tonsils aren't inflamed or obstructing the airway at all. so no signs of infection there. I would have taken off the cap to look at her mouth, just using the light, no cap needed. So let's keep doing your cranial nerves. Go ahead and puff out your cheeks for me. Very good. Raise your eyebrows, all symmetrical and even. Put my hand on your cheek, and you're gonna turn to your left and make sure I can't push you away. Okay? Very good. Same thing. And with your shoulders, raise them. Don't let me push you down. Very good. While I'm in this area, we can do the lymph nodes, making sure nothing's inflamed or hard. You can even do that at home. If you have those symptoms, or you feel any hardness or tenderness, they could show signs of infection. You don't want to feel anything. So if you do notice any hard tenderness, call and let our office know.
Okay.
Okay. With your neck as well, since you were saying you have an underactive thyroid, we could test your thyroid. I'm gonna put my hands on your neck. Go ahead and swallow. Very good. Kind of with your hands on your neck, we are testing the trachea, making sure there's no deviation, and the thyroid, making sure it rises equally, no bumps more on one side than the other, and everything felt good and negative, so that is good. Let's continue with your neuro and your cranial nerves. Go ahead and hold your arms straight out. Don't let me push you down. Don't let me pull you up. And then go ahead and grip my hand. That's very tight. Okay. Pull me towards you. Palms. Pull me away. And then you said you work at a desk as an honor. Go ahead and put your hands like that. Do you have any pain?
No.
Okay. That could indicate carpal tunnel if you have pain. So that's good. Let's move on to your legs for your neuro. Go ahead and lift this leg for me. We're going to do the same thing. Don't let me push you down. Don't let me pull you up. Very good. Same thing. Down and then up. And then while you're down here, we could look at her legs more so, kind of for the cardiac aspect. Let me go ahead and lift your leg. Very good. Checking for any edema, if it is, weeping in the diabetic population, making sure we check those heels and the toes for any diabetic ulcers, checking the pulses. Her skin is warm, dry, and intact. No new cuts or anything to be concerned about. So that looks great. Kind of talking about the skin, through the whole process, we're always kind of inspecting, and then we'll auscultate, palpate, or percuss if need be. And with the skin, we can also test the scalp, making sure, looking at her hair, the thickness or the thinness of it, and the hair follicles, seeing if if she is malnutrition in the older population, just checking the grays and loss of hair. In the males, maybe checking to see any of their sun exposed areas, making sure they have it with sunscreen. Especially maybe more the teenage girls, just checking since they're out in the sun, sunbathing, making sure we really emphasize sunscreen and checking if there's any signs of skin cancer. Let's see. I got all that, I think. Let's move on to your auscultating your lungs and your heart. Lungs, you'd always want to listen in 5 spots, anterior and posteriorly. Making sure it's even, strong, no coarseness or crackles, and then also inspecting to make sure there's equal expansion, and she has no barrel chest or anything like that. This side, raise your arm. This side, raise your arm. Posteriorly. Deep breath. Okay. One more. Last one. Okay, very good. And she sounded good. And now we can listen to the heart. Well, just making sure you listen in 4 spots, especially the spots where we can hear the valves the best. Just breathe normal. And then with the females, maybe sometimes you need to push the breast out of the way. If I haven't already said, making sure we listen on skin, in the clinical setting, they would be in the gown. So make sure you remove the gown and really listen on the skin where you don't have any adventitious sounds. I think that's the correct word. Since I have my stethoscope, let's check your D10 and reflexes, DTRs. Kind of hang loose. I'm going to hold your arm. You can check here. You could use a hammer. We're using the stethoscope because we're using what we got right now. And definitely not the best at this. Sorry if I hurt you. Do the patellars. Work in progress there. Next, we could listen to your abdomen inspecting. First, we'd have the patient lay down. And we could always listen to the patient's heart and lungs laying down as well, making sure if we could hear different sounds when they're laying down versus sitting up. But moving on to the abdomen, we're inspecting first, and then we'll listen to at least the 4 quadrants. Okay. Any pain when I touch you?
No.
And then you could always palpate deeper, checking for rebound tenderness, especially in the appendix. In the younger population, making sure they don't have an inflamed appendix. Checking for organ megaly. Let's see what else. Talk about palpation, or in the young population, we would also be checking their head for lice, since that can occur very easily in the children. And then while she's laying down, we'd also want to check for the JVD. We could check that when they're sitting up anteriorly and posteriorly. And then you're just asking the patient to look away from you. And then you're checking here to make sure there's no like abnormal pulsation or like swelling. You have none, so you are good. We can move on for the females. We could do the GYN exam. In this, for the video, we'll refer them to their OBGYN or GYN. And she goes the one for her breast exams, her mammograms as well. If it was a male, we could do the prostate and rectal exam now if need be. And then let's test one more thing. You can test your gait. You want to have a stand for me. Go ahead and just walk a little bit and come back. Okay, come on back. And just making sure she's equal, not unsteady or wobbly on her feet. She's able to walk straight without any assistance of a walker if she was older. Are you able to bend down? Mm-hmm. Okay, go ahead and bend down for me just a little bit. And we're testing the spine, making sure there's no scoliosis. Go ahead and come back up. No pain or anything?
No.
Okay, very good. I think you can have a seat. Going through my head, make sure I didn't forget anything for you. Did you do the finger?
No.
I don't think you did. Let's keep testing some of the neuro for you. Look straight ahead at me. Don't move your head, just move your eyes. I'm going to move my finger and you follow, okay? All her ocular muscles look good. She's able to move. Go ahead and put your finger to my finger, and this is kind of testing her coordination. And then put your finger to your nose. Okay, do it again. One more time. Very good. Okay, you were able to complete all the tasks. That's good. Do you have any questions?
No, I don't think so.
Okay, well, it looks like you're doing healthy pretty well. Keep working on the exercise regimen best you can. We'll refill your prescription for your blood pressure, and we'll check your labs for your thyroid, making sure we have the correct dosing there. And then keep trying to take a log of your blood pressures, or we can have some like factual data showing that the dosing is correct. If not, we can always adjust. And then don't hesitate to call the office if you have any questions prior to that. Otherwise, I think we could see you in a year.
Okay.
Okay. Thank you. You're welcome.